Hello, my name is Cooper Duke. I'm the Occupational Safety Coordinator here with the Environmental Health and Safety Department. Today we're going to be talking about back safety. Here's some of the objectives we're going to talk about today. We're going to talk about back injuries, some of the common causes of those injuries, how we can prevent these injuries from occurring, principles of safe handling, some proper lifting techniques, and then at the end we'll give you some exercises that you can do to prevent these injuries. Here's some back safety facts. Around 80% of the population can expect to have back pain at some point of their lives. About 8 million Americans suffer new back injuries every year. And twice as many back injuries occur at home as in the workplace. So these are good things. I'll show you some good things to remember, not just for work, but at home to keep you from getting these back injuries. Here's a couple charts related to back injuries involving lost work. If you look at the pie chart on the left, you can see almost 3/4 of all back injuries are in the lumbar area, which is going to be your lower back. If you look at the picture on the right side of the screen, it'll be L1 through L5 is going to be your lumbar area. That's where most of the back injuries are going to occur. And they can also be up in the upper back, in the thoracic area. That's around 11%. But most of the time, back injuries are going to be in the lumbar area. Here's a quick video that we'll watch that is the anatomy and physiology of the human spine.
The back is an intricate structure of bones, muscles, and other tissues that forms the posterior part of the body's trunk, from the neck to the hip bones and pelvis. The bones that form the core of the back structure are called the spine or spinal column. This stack of more than 30 bones, vertebrae, supports the upper body's weight and houses the spinal cord, the nervous system structure that carries signals which control the body's movements and convey its sensations. Each of the bones that make up the spinal column has a hole in the center, and when these bones are stacked, it creates a channel that surrounds and protects the spinal cord. The bones or vertebrae that make up the spinal column are not stacked directly on top of each other. There are spaces between them that are maintained by round spongy pads of cartilage called intervertebral discs. Each intervertebral disc is made up of two components, the annulus fibrosus and the nucleus pulposus. The annulus fibrosus is the tough outer portion of the disc. The nucleus pulposus is the inner gel material surrounded by the annulus fibrosus. These discs and the space between the bones that they fill give the lower back flexibility. The discs act much like shock absorbers throughout the spinal column to cushion the bones as the body moves. Bands of tissues called ligaments and tendons hold the vertebrae in place and attach the muscles of the back to the spinal column. Small nerves called roots enter and emerge from the spinal cord through spaces between the vertebrae. The spine has 4 regions. Starting from the top, there are 7 cervical or neck vertebrae, labeled C1 through C7, 12 thoracic or upper back vertebrae, labeled T1 through T12, 5 lumbar vertebrae, designated L1 through L5 in the lower back, and finally the sacrum and coccyx, a group of bones fused together at the base of the spine. Intervertebral discs are located between each vertebra from C2 through S1. As we age, a number of changes can occur in the spine, which may contribute to or cause lower back pain. For example, the annulus surrounding each disc begins to develop tears and cracks, which can cause pain and inflammation. The discs also begin to lose the water that keeps them spongy and enables them to absorb shocks and help protect the spine. As the discs lose water, they become compressed or flattened, which reduces the space between the vertebrae. In turn, the facet joints that connect the vertebrae and allow for easy movement are compressed. Pressure builds on the cartilage that covers and protects the bones from rubbing directly against each other, which can damage the joints. These changes may result in looser, less stable movement, which further increases the process of degeneration. As part of this process, the tough outer ring of the discs may develop larger tears so that the nucleus bulges out, what is commonly called a slipped disc, pressing on the spinal nerves and causing inflammation. The vertebrae may also lose mineral content so that the bones become thinner and the spinal column becomes compressed or packed together, causing pain. Bone spurs caused by aging and overall use of the spine may also form on the vertebrae and press on the nerves of the spine.
Here's the back injury cycle. This is kind of a circle of how these injuries happen and how they continue to be a problem. So you're going to start with the back problem at the top, and it'll move on to hurting to move. And after that, you'll stop moving, which causes stiffness, and which also causes weakness, which contributes even more to your back problem. And it kind of can just keep going around in a circle. Here's a diagram on lifting, and this is the proper position of how you want to lift. The position of the load relative to the body is as important as the weight. So as you can see, the further out that you move the weight, the heavier it's going to get, the harder it's going to be to lift. The higher the load is also going to contribute to it being more of a difficult lift. So you're going to want to keep the load close to your body whenever you're lifting. Here's some back safety in lifting. Whenever you're doing heavy lifting, use equipment whenever it's possible, or ask for help to do a team lift so you can reduce the strain on your back. Try to avoid repetitive lifting over a long period of time. Another big one is to avoid twisting. You don't want to twist while lifting or holding a heavy load. You want to keep your back in line. When you're reaching and lifting, often the injuries will occur whenever you're reaching over your head or across a table or out of the back of a truck. Carrying and lifting, the injury usually occurs when you're lifting or carrying objects that have odd shapes. Awkward positions can contribute to back pain. Poor posture is something that contributes to back pain, which is caused by bad lifting or by a poor workstation layout. If you slip, trip, or fall, it's very easy to injure your back, neck, or legs. When you're sitting or standing, this can actually cause a back injury. Sitting or standing too long in one position can be very hard on your lower back. Some other causes of some back injuries could be depression, anxiety, frustration, stress, anger, fear, or other psychological states that can cause back pain. Also, a loss of flexibility and strength are potential factors contributing to your back injuries and back pain. It's not about how much you lift or move, but the way that you do it. Some general rules of how you lift or move. Load, push versus pull. It's generally better to push rather than pull because when you're pushing, you can use your body weight. And pulling, you can kind of put more stress on your back and shoulders generally. So we encourage you to push the load rather than pull. You're going to want to keep work within the safe zone. If you see the picture over on the right, your safe lifting zone, the top of it's going to be around the top of your shoulders, and the lower end of that zone is going to be down by your hips. You're going to want to keep the load close to your body and in that zone. And whenever you're lifting, it's a good idea to brace your abdominal muscles or your stomach. Just Bracing kind of stabilizes your core, which can help avoid those injuries. And when you are holding the load, you're going to want to pivot with your feet and avoid twisting. You're going to want to keep your back aligned and avoid twisting your shoulders while you're holding the load. And always a good general rule is teamwork. You can split the load between a couple people, and then it's a lot lighter on both of you. That'll help avoid overstraining your back. Here's 5 good rules for proper lifting techniques. First thing is you're gonna want to get close to the load. Then you're gonna want to squat down, then grip the load, hug the load, and then slowly lift. It's very important that you slowly lift. So first we're going to get close to the load. You're going to get as close as possible with your feet about shoulder width apart. And with one foot slightly in front of the other, this will help with your stability and balance. You're going to want to get down there and test the object's weight before you're lifting it. Make sure it's something that you're able to do. And if it's not, ask for assistance from a coworker and do a team lift. And having the object close to your body will put less force on your lower back, and avoid rapid, jerky movements. You're going to want to go slow with the lift. So after you get close to the load, you're going to want to squat down and keep yourself in an upright position. And what that means is keeping your ears, shoulders, and your hips in line, just to keep that back straight. And you want to get low by squatting and bending your knees. You're going to want to use your legs to get down there. And after you're down squatted by the load, you're going to want to grip the load. And again, tightening your stomach or abdominal muscles will help support the spine. And do not hold your breath when tightening your muscles. You want to keep breathing. Get a firm grasp of the object before beginning the lift. Use both hands. Use your whole hands, not just the tip of your fingers wrapped around the bottom. You're going to want to get a good grip on it. And remember to hold it close to your body. Next is you're going to want to hug the load. This is where you're going to keep that load real close to your body within the safe zone, which is in between your shoulders and your hips. Remember to use your legs. Your legs are actually your strongest muscles in your body. You want to keep your head forward, and keep your ears, shoulders, and hip in line, and avoid back flexion, which would be pushing your shoulders behind your hips, or your head and your shoulders behind your hips. And hug the object to your stomach, chest. Just remember to keep that load real close to your body in that safe zone. And lastly is slowly lift. You're not going to want to do any jerky movements or quick movements or explosive. You're just going to want to try to stay stable and secure. And flex with your knees and hips, not your back. You're going to want to use your legs. Avoid bending and twisting at the waist. And try to keep the back straight during the lift. Another thing to remember is do not look down at the object during your lift. That would cause your ears to not be in line with your shoulders and hips. A good rule is to kind of just look straight ahead or look even up a little bit. Okay, so here's a quick demonstration on how to properly lift. You're going to want to get down, squat down close to the load, get it close to your body. Grip the load with your hands. You're going to want to lift straight up, keeping your ears, shoulders, and hips in line. And that's going to be the strongest way to lift without injuring yourself. You're going to lift with your legs. Remember to keep your hips, shoulders, and ears in line. And if you don't do that, and you don't get the weight close to you, see how he's reaching out here, and his shoulders are not in line with his hips. Lift up from there. Look at how much strain it's putting on the back. So you're going to want to avoid doing that. Keep the weight close to you. Get your ears, shoulders, and hips in line. And lift straight up, slowly, and using your legs. Using your hips and your legs to lift that load. Keeping it close to your body. and that's how you'll avoid injuring your back when lifting. Here's some things that we're going to look at of how to take care of your back. So proper lifting techniques, use the appropriate equipment, exercising can help strengthen all of those muscles and help avoid back injuries. Stretching is always good to avoid any kind of injury. And then correct posture is going to be one of those things that will help you avoid your back injuries. And avoid hyperextension movements of your back and hyperflexion. Hyperextension is going to be bending down towards your feet, and hyperextension is going to be moving your head back and shoulders back behind your hips. And hyperflexion is going to be moving down towards your feet. This would be bending down with your back rather than using your legs. Here are some benefits of conditioning. Strength and stability, of course, with exercise, you'll get more flexibility, aerobics for endurance, anaerobic for recovery, decreased risk of injury, and better job performance. Here's a quick warm-up that you can do to start safe, and this can help avoid your back injuries. Just do a quick 5 to 10 minute warm-up that should be specific to the activity, and gradually increase the intensity as you go through this warm-up. So if you're stretching your hamstring and reaching down to your toes, don't just go all in and do 20 seconds full stretch. Just get a quick 10-minute light stretch, come up, take a few deep breaths, and get back down into stretching your hamstrings. And again, don't overstretch. And you're going to want to hold each stretch for at least 20 seconds. And this is not stretching to the maximum, this is just getting a light stretch. Some aerobic exercise that would be beneficial to strengthening your back to help avoid the back injuries is 60 minutes per day is what's recommended. It'll give you weight management benefit, take a little bit of weight off of you. This will enhance your circulation, you'll have a healthier heart, and it'll decrease cholesterol. Some of the areas of focus to strengthen and get more flexible is going to be in your core area or your trunk, which is your abdominals and extensors. Your legs are also going to be areas of focus for strengthening because those are the strongest muscles in your body. That's what you're going to want to use when you're lifting. You'd use your quads, your glutes, and your hip flexors. Here are some stability exercises for strengthening your core. Crunches, press-ups, and bird dogs. So crunches, as you can see from the picture on the right, you're going to be laying on your back, and you're going to want to activate your core by lifting your shoulders off of the ground. Now this is not the same as a sit-up where you go all the way up to your knees. You're going to mainly be laying on your back and just push your shoulders towards your knees and just activate your abs. Next is going to be press-ups. You're going to start laying flat on the ground and then use your hands flat on the ground about a little bit wider than shoulder width, and just push up, and you're just getting to a good stretch. You're not going to want to push hardly, and then next is going to be your bird dogs. You'll start on all fours with your knees and your hands on the ground, and you'll alternate between your legs and your arms. You're going to want to lift your right leg and your left arm at the same time, and then you'll put your leg and your arm down and switch to your left leg and right arm up at the same time, and just repeat that. After your exercise, you're going to want to do a cool down period, and this is going to be an easy little stretch period to help prevent injury. This will rid your muscles of waste product. This will return heart rate and blood pressure to normal. And this is just going to be a light stretch, a gentle stretch for about 10 minutes. Remember, each stretch should last around 15 or more seconds. Here's some stretches you can do during your cool down period. Your quad stretch, you're going to want to put your hand on the wall or a table or something to help you gain stability, because you're going to be lifting one of your legs off of the ground. So you'll reach back and grab your foot to pull it back up and stretch that quad out. Next is the hamstring stretch. You can either do this by laying on your back like this picture is doing, or you can do it standing and just reaching for your toes. And then your lower trunk rotation, you're going to lay on your back and lift your knees up in the air just a little bit, and you'll slowly and controlled rock your knees from left to right. And this is just going to stretch out your core and your back. Bad posture can be the cause of spinal pain, and it can make existing pain worse. And it can certainly make the pain last longer. So getting your posture correct, getting your back in line, your shoulders, ears, and hips all in line will help with your posture. Here's some other ways that you can take care of your back. Some relaxation techniques, staying hydrated. Recommended to drink at least 64 ounces of water a day. And make sure you keep your stress managed. Just don't get too stressed out. And of course, rest and sleep is always good for healing. And ensure proper sleeping methods. This is the Rice method, and this is for treating injuries. You're going to want to rest the area that is injured. Avoid using the area until pain-free. You're going to want to ice for 20 minutes at a time every few hours. Compression can help a lot too. This is going to be a pressure bandage to reduce swelling. And again, it's good to elevate or raise your injured area at or above your heart level. This will reduce swelling. Here's some things to remember for when you need to go see your doctor. If your injured limb or joint is deformed, if there's broken skin over the injury site, if you've got any tingling or numbness, inability to move the area without pain, your joint feels unstable, you can't bear weight on it, or if swelling starts to occur. If swelling does not go away, does not improve within 48 hours, you're going to want to see a doctor, or if your swelling begins within 30 minutes of injury. Here's some takeaways from today's training. Some common causes of back injuries, preventing back injuries, how we can go about doing that, principles of safe handling, proper lifting techniques, and exercises. Here are some general questions that we get while we do these trainings. What if my department does not offer a pre-stretch exercise program? Well, if they aren't doing pre-stretch, that doesn't mean that you can't. So you implement stretching into your own routine will help you. You can do this before and after. If your coworker refuses to help you team lift while lifting at work, what can you do? Well, don't try and lift the load yourself, especially if you don't think you can handle it. And talk to your supervisor and just ask for help. See what we can do, what we can come up with to help you move whatever you're needing to move without straining you and your back. Where at OSU can I exercise as an employee? Well, we actually have a great gym called the Colvin Center. There's a lot of classes, equipment. It's a great facility to visit and do workouts at to strengthen your body, strengthen your core, strengthen your back. That'll help avoid your injuries. Are there any workplace recommendations on how much weight one person can lift by themselves? Well, it depends on the person, but the general rule is 50 pounds or less. Here at OSU in the Environmental Health and Safety Department, we offer different programs and services. As you can see on this list here, we offer lots of safety training. I think it's over 40 different subjects. If you give us a call, we can kind of tailor the training to what you need. We can combine them or kind of tailor them to whatever area you're working in. And here's my information if you need to reach out with any questions. Thank you very much for listening to the training.